I am 102 years old. I have worked as a doctor for 53 years, and during that time, I stood by the bedsides of more than 4,000 patients as they died. I am not telling you this to brag. I am telling you this because I have seen things that most people never see. I have watched how the human body fails, and more importantly, I have seen how the medical system fails older people. I do not want your pity or your amazement. I want you to listen to me because the advice I am about to give you comes from a century of living and half a century of practicing medicine. I am still here and my wife and children are gone, which means I know something about survival that you need to hear. Many people think they get sick and die just because of bad luck or bad genes, but that is often wrong. It is about the choices you make. Today, I need to talk to you about a very specific choice: how you handle your doctors. You might trust your doctor completely. You might think they look at you and see a person who needs help. But I have interviewed hundreds of healthcare workers and watched this industry for decades, and I have to tell you the truth. There are 5 ugly realities about what doctors actually think when they see an older person. They do not talk about this to your face, but these thoughts affect your care, your respect, and how long you will live. The first ugly truth happens before you even open your mouth. The moment you walk into the medical office, the doctor looks at your age and immediately puts a label on you. In their mind, you are expensive and complicated. This is not because they are bad people. It is because medical schools teach them to work fast and be efficient. They are trained to guess how much time and effort a patient will need. When they see someone over 60, they automatically think that this patient will take a long time, need many tests, and have confusing medication lists. This is a problem because of money. Doctors today are under a lot of pressure to see many patients quickly to make money for the clinic or hospital. Insurance pays them less and quotas are high. When you walk in with your complex needs, you are basically a problem for their schedule. Studies actually show that doctors spend about 23% less time listening to patients over 65 compared to younger people with the exact same symptoms. Think about that. You are older, so your health is more fragile, yet they listen to you less. Let me give you a real example so you understand how dangerous this is. There was a 74-year-old woman named Maxine. She was a retired librarian, very smart and organized. She went to her doctor with a list of symptoms she had written down over several weeks. She did everything right, but before she could finish her first sentence, the doctor stopped her. He told her they needed to focus on just one thing because they did not have time. When she tried to explain that her chest pain and other feelings were connected, he sighed. He told her they had to prioritize. He decided her chest pain was just anxiety because he did not want to deal with a complex problem. That decision delayed her heart diagnosis by 6 months. This happens all the time. Doctors are often scared to order big tests for older people because they are afraid they will find too many problems that are hard to fix. They would rather treat the easy surface symptoms than dig deep and find the real issue. They see you as a burden on their time, not as a partner in health. You cannot let this happen to you. You must stop being passive. If you want to survive, you have to change how you talk to them. When you sit down, do not just complain about feeling tired or sore. If you say vague things, they will dismiss you. Instead, you need to speak like a younger person with a plan. Tell them exactly what your goal is. Say something like, "My energy has dropped 40% in 3 months and I want to find the cause." This makes you sound like a serious patient who wants results. Bring a one-page summary of your health so they can read it fast. And if they try to rush you, be firm. Tell them, "Doctor, I know we have little time today. Can we book a 30-minute appointment next week to talk about this properly?" You have to force them to respect you, or they will just rush you out the door. The second ugly truth is something I call polite medical gaslighting, and it happens so often that most doctors do not even realize they are doing it. This is when a doctor blames your real medical symptoms on just getting old instead of looking for the actual disease. I have seen this thousands of times. A patient comes in with pain or fatigue, and the doctor simply shrugs and says, "Well, you are not 30 anymore. This is not medicine. It is laziness." Dr. Michael Torres, a geriatrician I respect, calls this a medical cop-out. It is a way to stop investigating your problem so they can move on to the next patient. The numbers on this are terrifying. Research from the American Geriatric Society suggests that 85% of serious conditions in older people are initially blamed on aging before the real diagnosis is found. Think about that. If you have heart disease, they might just say you are tired from age. If you have a thyroid disorder, they say it is normal energy decline. Even depression is often ignored because doctors think it is normal for old people to be sad. This is dangerous. I want to tell you about Carl, a 67-year-old man who used to be a construction supervisor. He was a tough man. For 8 months, he went to his family doctor complaining that his joints were stiff and he felt exhausted. Every single time, the doctor told him, "Carl, your body is just slowing down." Carl believed him because we are taught to trust doctors. But when Carl finally got angry and demanded blood work, they found he had severe rheumatoid arthritis. Because the doctor had wasted 8 months blaming old age, Carl suffered permanent damage to his joints. You have to know how to stop this. When a doctor tells you a symptom is normal for your age, do not just accept it. Ask them a very specific question. Ask them, "What would you do if I were 40 years old and had these same symptoms?" This question forces them to realize they are treating you differently just because of your birth year. Also, do not just say you are tired. Give them facts. Say, "I was fine until March 15th, and now I need a nap every day." This is a sudden change, not gradual aging. Make them prove to you that it is age, rather than accepting their guess. The third ugly truth is even more insulting. Doctors secretly believe you are mentally declining, even if you are not. Because of this, they often decide you cannot handle complex treatments or difficult explanations. I have interviewed psychologists who study this, and they confirm that healthcare providers consistently underestimate the intelligence of patients over 65. They speak to you slowly, they use simple words, and worst of all, they recommend simple treatments instead of the best treatments because they think you will get confused. This leads to tragic situations like what happened to Louise. Louise was a 71-year-old retired chemistry professor, a woman likely smarter than the doctor treating her. When she was diagnosed with early-stage breast cancer, her oncologist immediately recommended a simple mastectomy. He did not talk about reconstruction or new targeted therapies. When she asked why, he said, "At your age, we want to keep things straightforward." He assumed that because she was 71, she could not handle the complexity of modern treatment. Louise had to fight for months to get the same care a 40-year-old woman would have been offered immediately. This happens with medication too. Doctors often prescribe older, less effective drugs simply because they're taken once a day. They avoid better, newer drugs that might need to be taken twice a day because they assume you will forget or mess it up. They are prioritizing what is easy for them over what is best for you. You need to shatter this assumption the moment you sit down. If you have a profession or a background that required thinking, tell them. Start the conversation by saying, "I managed complex projects for 30 years, so please give me the detailed medical information so I can make a decision." If they try to dumb it down, stop them. Ask for the technical terms. Ask for the evidence. Show them you are sharp. Use your smartphone in the appointment to look things up or take notes. When they see you using technology and asking hard questions, they will stop treating you like a child and start treating you like a patient who wants to live. The fourth ugly truth is one that keeps me awake at night. It is the fact that many medications prescribed to older people are not meant to treat a disease, but to control their behavior. This is what Dr. James Martinez calls chemical restraint disguised as medical care. I've seen this happen in hospitals and nursing homes for decades. When an older patient asks too many questions, complains about pain, or gets frustrated with slow service, they are often labeled as difficult. The solution is rarely to talk to them. The solution is to give them a pill to make them quiet. The statistics prove this. Over 40% of seniors are on some kind of psychiatric medication, but only 12% actually have a diagnosed mental health condition that requires it. The gap between those numbers represents millions of people who are being drugged simply to make the staff's job easier. They give you sedatives for anxiety when you are just worried, or mood stabilizers for agitation when you are just insisting on better care. I need you to hear the story of Beverly, a 69-year-old former school principal. She was a woman who was used to being in charge. After she had hip surgery, she felt her recovery was going too slowly. She started asking the nurses and doctors detailed questions about her timeline. Instead of answering her, the medical team labeled her as anxious and difficult to manage. They prescribed her a strong anxiety medication to calm her down, but the pills made her confused and dizzy. Because of that confusion, she fell and broke her wrist. Her recovery, which should have been simple, was extended by 4 months because they drugged her instead of listening to her. You must be very careful. Pain medication is often withheld because they think you are seeking drugs, while blood pressure medication is pushed even when it makes you dizzy. To protect yourself, never accept a new prescription without asking 3 specific questions. What exact medical condition does this treat? What objective test shows I need it? And how will we know when to stop taking it? If they cannot answer these clearly, refuse the pill. Do not let them sedate your personality just because you are an inconvenient patient. The fifth and final truth is the most heartbreaking of all. Behind closed doors, there is an economic formula that decides if your life is worth saving. It is a cold calculation. Doctors and hospitals weigh the cost of a treatment against how many years you have left to live. They call it quality-adjusted life years, but I call it discrimination. They systematically value the life of a 70-year-old less than the life of a 40-year-old. This means you might be denied expensive surgeries, advanced screenings, or organ transplants, not because your body cannot handle them, but because the system thinks you are a bad investment. Dr. Patricia Chen, an expert in ethics, has shown that this happens every day. A surgery that is automatically offered to a younger person is deemed too risky or not cost-effective for you, even if you are healthy enough to survive it. Let me tell you about Walter. He was a 68-year-old retired engineer, and his kidneys were failing. When he went to the specialist, they told him that at his age, dialysis might not be appropriate. They suggested palliative care, which is a nice way of saying they would make him comfortable while he died. Walter knew he had more life to live. He fought them for 3 months. He demanded the same treatment a younger man would get. Finally, he got his dialysis. Do you know what happened? He lived 7 more productive, happy years. He saw his grandchildren grow up. The system wanted to let him die to save money, but he forced them to let him live. You have to be like Walter. You have to be like Beverly before they silenced her. When a doctor suggests a limited treatment plan or tells you to just be comfortable, you must ask them the most powerful question in medicine. Doctor, would you recommend the same plan if I were 45 years old? If the answer is no, make them explain why. Make them give you a medical reason, not an economic one. I am 102 years old. I have outlived my wife, my children, and most of my colleagues. I am still here because I pay attention and I refuse to be treated like a statistic. You now know the 5 ugly truths that the medical industry tries to hide. They think you are expensive, complicated, mentally slow, and not worth the investment. But knowledge is your weapon. You can walk into your next appointment and demand the respect you deserve. Do not be passive. Do not be polite if it means sacrificing your health. You are not just an old person, you are a survivor. Now go out there and fight for your life because no one else is going to do it for you.